Good day. I am Manole Cojocaru, Professor of Physiology and Immunology at Titu Maiorescu University, Faculty of Medicine of Bucharest, Romania, Senior Scientific Researcher Degree 1, European Specialist Laboratory Medicine, Senior Specialist Allergology and Clinical Immunology. I am honored to present you the theme Deniplant nutraceuticals, supportive therapy and adjuvant for the female reproductive system dysbiosis. Most research has focused on the oral, skin and gut microbiomes, whereas relatively little is known about the reproductive microbiome. Most of the studies selected focused on treating bacterial vaginosis as the most common dysbiosis. A few studies focused on vulvovaginal candidias and on pre-treatment during in vitro fertilization. The effects of microbiota imbalance seem to contribute to trigger reproductive, hormonal and metabolic disorders. Infertility incidence has so increased in the last years that it is currently recognized as a worldwide health issue. If microbial dysbiosis occurs, subsequent decreased enzymes levels may diminish circulating estrogens and lead to recurrent reproductive pathologies. Special attention has been paid to the following dysbiosis sites: vaginal, cervico-vaginal, endometrial, and indirectly placental microbiotas. The vaginal microbiota show a specific colonization pattern for each woman. In the vaginal microbiota, the Lactobacillus genus is dominated and determinant during the establishment of a healthy microbiome community. Recently, certain authors have postulated on the specific colonization of the endometrium. Specifically, a decrease in the Lactobacillus population appeared to be linked to implantation failures or early miscarriage in vitro fertilization patients. The use of nutraceuticals, among other approaches, could improve the dysbiosis of female reproductive system microbiome. The effects of nutraceuticals from Deniplant on dysbiosis of reproductive microbiome and fertility were reviewed. Female reproductive microbiota has also been suggested to affect infertility, and it may play a key role in the success of assisted reproductive technologies such as embryo implantation and pregnancy care. Probiotics remain an important complementary intervention resource to modulate dysbiosis of the microbiota, which were associated with various metabolic disorders and diseases. Most clinical trials on the modulation of reproductive dysbiosis have been carried out using oral probiotics. The use of Deniplant nutraceuticals could be interesting in the management of dysbiosis of human reproduction. We review the state of the art regarding the role of the female reproductive system microbiota in women's health and human reproduction, highlighting its contribution to infertility. Dysbiosis has been related to several diseases, including chronic endometritis, endometriosis, pelvic inflammatory disease, and gynecological cancer. Understanding the composition, dynamics, and stability of patients' microbiota in different areas of the body and identifying changes that occurs during disease onset or progression can aid in the development of personalized microbiota-based therapies. Bacterial vaginosis is the most prevalent reproductive disorder and is linked with gynecological complications like spontaneous preterm labor, abortion, and endometriosis. It can be cured by restoring the representative vaginal components of the microbiota with probiotic formula, usually species of the genus Lactobacillus. Bacterial vaginosis is strongly implicated in underestimated causes of unexplained infertility. Bacterial vaginosis is meaningfully linked with preclinical pregnancy loss. There are other common dysbioses, such as endometriosis, that have been linked to an unfavorable effect on fertility. In conclusion, we have reported a positive correlation between the presence of specific bacteria in the uterus and the onset of pelvic inflammatory disease and inflammation of the upper genital tract that can lead to infertility. Gestational infections and inflammations reduce fertility and increase the risk of preterm birth. Furthermore, spontaneous abortion and preterm deliveries, including not implantation of the embryo, could be highly related to episodes of microbial dysbiosis. This could be modulated by restoring the disrupted microbiota. Thank you for kindly invitation. Thank you for your attention.